How does precision impact treatment out? I'm sorry. How does precision impact treatment outcomes in focal therapy? How,
Yeah.
how does precision impact treatment
Yeah, the
outcomes
being
in focal
accurate,
therapy?
being accurate, being precise, right? There's a
Yeah.
set of action focal, set
Okay,
us
so
immediately.
there's just a comma missing. How does precision treatment impact outcomes in focal therapy?
So precision with prostate cancer treatment is so important for quality of life and for cancer control. So oftentimes the cancer is close to the edge of the gland, or we call that the capsule. So that means it's very close to the muscle for urine control, or it's very close to the nerves for sexual function. And so precision is critical. And one of the things that we really like with focal ablation, with Sonoblate HIFU, is that we're able to select very small treatment regions and then add them together to create a treatment zone. So that way, instead of doing whole gland therapy, say with radiation or with robotic surgery, we can do focal ablation or partial gland therapy.
Thank you. Every prostate is different. How important is physician flexibility during treatment planning and execution?
So we're talking about TCMs and all the actual physician's control during the procedures. Now we're really talking about differentiation between us and focal one, yeah.
Yeah, and how did you word the question?
Every prostate is different. How important is physician flexibility during treatment planning and execution?
It's really remarkable how unique every prostate is, both in size. So some prostates are 20 grams in size and might be 3 centimeters in height, and other prostates are 100 grams, 80 grams, and might be 4 or 5 centimeters in height. And then the cancer within each prostate can be a different size or in a different region. And so for each patient, actually during the treatment, we're monitoring and adjusting. Anytime you apply an energy to, or you apply heat to the prostate, there's some swelling and there's some movement. So one of the things I like most about the Sonoblate 500 is that we can adjust that treatment as we go. So it's giving us live imaging during treatment, and then we can pause, we can adjust, we can expand or change the treatment zone or retreat the treatment zone on the spot, and really without any additional time added to the procedure. Each prostate responds a little bit different to heat as well. And built into the software with Sonoblate is what's called tissue change monitoring. So it gives us a reading on a change in the tissue between a pre-treatment ultrasound and a post-treatment or live ultrasound. And so that gives us some idea of how the heat is accumulating and killing the cancer cells. Now, obviously we can see visual changes of the heat there as well during treatment, which guides us. But the Sonoblate gives the surgeon really a lot of flexibility on the treatment and on basically sculpting the treatment to follow the gland's shape and size as well, because the prostate is not it's not a square organ. We say it's more of an ellipse shape, and so with Sonoblate we can follow the curve of the gland in a sub-millimeter fashion because the probe is anchored to the bed, and we have a stepping device that enables very fine changes in the treatment. This is especially important along the rectum. So on the posterior aspect, where a lot of the prostate cancers are, near the rectum, we're able to do sub-millimeter adjustments of the treatment zone during treatment.
Thank you. These questions might seem a little redundant because I feel like you just answered them, but I'm going to ask
doing
you.
like long run-on answers.
I'm going to ask you anyways. How do you tailor treatment strategies to the individual patient's anatomy and disease characteristics?
Yeah. So when we receive the biopsy, the clinical data, the MRI, and potentially the PET scan, we put all these together to develop a treatment plan. And the Sonoblate software, through MIM software, enables us to do fusion treatment if we feel that that's going to be helpful. But even more, during the treatment, we're able to analyze or observe the treatment changes, because as the prostate takes in heat, it's going to potentially change in size. There's going to be some swelling or some movement of that. And so the Sonoblade device allows us to adjust the treatment on the fly.
Why is real-time physician decision-making important during HIFU procedures?
Well, you make a plan, but you always want to be able to adjust for that plan. And particularly in prostate, because we're always close to quality of life structures. So during the heat treatment, we're close to the muscles that for urine control, we're close to the nerves for sexual function. And so we're close to the urethra or the bladder neck. And so all these structures we're watching and monitoring during treatment. And we can adjust, during the treatment based on how the tissue responds to the heat.
What outcomes have impressed you most in your Sonoblade HIFU experience?
Well, first off, the quality of life with HIFU, with Sonoblade HIFU, is incredible. So sexual function, it's pretty rare for the sexual function or erectile function to change at all with the heat treatment. So we tell guys maybe 10 to 15% of men will see a change with erections, and that's typically a minor, small change. And so that's remarkable. Urinary control, so stress urinary incontinence is extremely rare after HIFU. So, we would say less than 3%. And so those quality of life changes are remarkable. Now, as we've grown as a field, initially it was whole gland HIFU because we didn't have MRI targeted treatment. Now we have MRI or PET targeted treatment. And so now we're even adjusting how we deliver the treatment. So now we mostly do hemiablation or focal with some treatment margin. And even more recently, we've realized or we've adjusted to do compression on the prostate during the treatment. And so those advancements have led to remarkable treatment outcomes. One of the things that always surprises me is to see the MRI after the HIFU treatment, and we generally get an MRI and follow-up, between 6 and 12 months after the HIFU treatment. And oftentimes we'll see that the side or the area that we treated is just completely gone. So very reassuring for the treatment.
Can you explain what a hemi procedure is?
Yeah, hemi as opposed to whole gland. So hemi means we're focused on one side of the prostate, so either the right side or the left side, and that really maximizes quality of life. So if we're just treating a cancer that's just on one side of the prostate, the likelihood of any quality of life decreases very low.
How do you measure success after a HIFU treatment?
So, the patient thinks in terms of maybe three separate aspects of that. One is their experience with the post-op recovery. And with HIFU, that's remarkably fast. So there's no incisions, there's no radiation. And so really, then there's not a lot of sensation to the prostate itself. So really it's just the post-op urinary catheter, that's the initial bother. But once that's out, it's remarkably quick recovery time. And so for the patient, that means less time off work or quicker return to their activities or to travel. But another major aspect, of course, is that they maintain their quality of life. And then finally is the cancer control, the oncologic control. And so, all three of those domains are very important for the patient experience and outcomes.
Why would you treat BPH and prostate cancer at the same time?
Yeah, so oftentimes, prostate cancer and benign prostatic hypertrophy run together. And so they can have both a prostate cancer and lower urinary tract symptoms, such as a weak stream or trouble starting stream or urinary frequency. And we know, based off of the MRIs after HIFU treatment, that HIFU effectively shrinks the zone that we treat or obliterates it. It atrophies, gets reabsorbed. And so for us, then they're just left with the contralateral or the non-treated side. And so a few years ago, for those men that had a weak stream, lower urinary tract symptoms, we started offering the cancer treatment, but at the same time, contralateral or opposite side treatment with HIFU, so they would have the best kind of long-term urinary control, urinary function.
Thank you.
Procedure-wise, right, the dural application is just only adding 20 minutes. Some are actually talking with your peer physicians. What does that mean for their practice?
Yeah, that's a great point. So when patients have both prostate cancer and a weak urinary stream, in that case, while they're asleep and we're treating their prostate cancer, treating the BPH is a fairly minor addition to the treatment. They're already asleep, we're already providing HIFU, and so treating the BPH at the same time is does not add that much time. And in some ways, if you plan the treatment where it's skipping back and forth between the cancer treatment and the prostate enlargement treatment, it can help to balance the treatment in a sense, maybe decrease prostate swelling, decrease overheating, and speed up the treatment time.
Thank you. What role does precision treatment play in preserving urinary and sexual function?
We covered that part.
We did already?
Yeah.
Oh, gosh. How do patients typically respond when they learn about HIFU as a treatment option?
Yeah, when patients hear about HIFU as a treatment option, it's compelling. So they have to sort through their treatment priorities, and if quality of life and treating the cancer, if both those are very high priorities, then patients appreciate knowing about all the treatment options, and so they're often very thankful to be able to talk through another treatment option. They know about radiation, they know about surgery in general, but oftentimes they don't know as much about focal therapies like HIFU.
What patient population benefits most from Sonoblit HIFU?
Yeah, so men who are active, men who have a good sexual function that they want to preserve. So men where quality of life is really important to them are the best candidates for HIFU. And so we often target men who have intermediate risk. So the most common prostate cancer diagnosis is intermediate risk, and those are the best candidates for an ablative therapy like HIFU.
Adding on that part, active surveillance, right? So
Mm-hmm.
you treat the actual patient with active surveillance as well.
Yeah, I agree. Also, men who have low risk or men who are on active surveillance can also be really good candidates for HIFU because of the low side effect profile. So we know that men with, let's say, 3+3 low risk prostate cancer, if you follow them over 10 years, up to 50% will fail the active surveillance, that their cancer will progress. And so many of them are really good candidates, especially if they have an MRI lesion. So to provide active surveillance, but with HIFU, with Sonoblate treatment, and the logic is, we want to decrease the progression of that cancer to a more aggressive cancer that would require whole gland therapy.
And add on that one, salvage treatment.
Yep.
Post-radiation, do you treat patient in that category?
Yeah, another indication for HIFU, and one that we did a clinical trial here at IU around 20 years ago, is salvage therapy. So men who have failed radiation therapy can be great candidates for HIFU. And typically those prostates are smaller after radiation therapy, and oftentimes they're imaged with PSMA PET scans due to cancer failure. So you have a great imaging MRI, PSMA PET to help guide the treatment. And, we know that redoing radiation or salvage prostatectomy comes with higher risks of incontinence and sexual function. And so HIFU, can be a great treatment option for those men.
Thank you. As a high,
Good job, Yuki.
yeah, good job, you.
Well, otherwise